Sitting for hours in an A&E department is wearying, even for a person in the full of their health. To have a person aged over 75 sit in such an uncomfortable and stressful setting for over 24 hours is further compounding their ill health. A lack of basic bed capacity is a fundamental problem in healthcare in Ireland, and if the Minister can't get to grips with even the basic problems 3 years into his tenure, then we are going to see thousands more over 75s languish in A&Es across the country. A very apt quote, don't you think? No, that's not a recent quote, and no, it hasn't been said by anyone currently sitting on opposition benches. No, that was said by our current Minister for Health, Stephen Donnelly, when he himself sat on opposition benches in June 2019, while reflecting on the number of patients over 75 left waiting on trolleys for over 24 hours in the first half of 2019. Another quote from his time on opposition benches was when he said in 2018 that the figure of 1 in 3 people on trolleys being over age 75 was borderline elder abuse. Fast forward to today and, well, it all sounds a bit similar, doesn't it? Basic bed capacity is still a fundamental problem in Ireland's health service, and many people, old and young, are sat on plastic chairs or on trolleys lined up throughout emergency department corridors for more than 24 hours. In fact, in some cases, for over 50 hours. Trolleys so close together that there's no chance of privacy or dignity. And that's to say nothing about the lack of distancing when we were experiencing a huge surge of respiratory viruses. But let's contrast these quotes with what Minister Donnelly has been saying lately, shall we? He has said that things are going to get worse before they get better. He said that the government focus is on making sure that all measures that can be taken are taken. And he refused to call the reports of a 75-year-old on a trolley for 57 hours borderline elder abuse, instead saying it is certainly completely unacceptable. Unacceptable. A word also used by Taoiseach Leo Varadkar to describe patients being left for hours or left overnight on trolleys. Unacceptable. I think we're past unacceptable, aren't we? I think we've shot past that quite a few years ago and have now landed at indefensible or inexcusable. Unacceptable just doesn't cut the mustard after all these years of mismanagement of the bloated excuse for our health service. A health service that is one of the best funded in the world. All those billions, 23 this year in fact, pumped in year after year, and for what? For pensioners to be left languishing on trolleys for hours on end, for ambulances to be backed up outside an emergency department because they can't unload their patients as there's no more room at the inn, and for the disgraceful, inevitable outcome to this utterly horrendous trolley crisis, the death of a 16-year-old girl, Aoife Johnson, due to meningitis as she sat waiting for up to 16 hours for treatment. Unacceptable just doesn't go far enough. Inexcusable. The INMO have been flagging this winter crisis since July, and yet it seems Minister Donnelly, who was so full of ideas when on opposition benches, did nothing to prepare for the coming storm. He, and by extension the government, waited until the storm was upon us to attempt any emergency action. He followed Leo Varadkar's lead by calling for the use of private hospitals to help. He has called for consultants and other senior medical staff to work overtime to help. A call to action like that for medical staff doesn't sit right with me. Firstly, they wouldn't need this call for action if they looked after their frontline staff in the first place so that we didn't have this brain drain that leaves us short. And guess what? The housing crisis, the other crisis, the one that hasn't gone away with yet another homeless record broken, plays into retention of staff in our health sector. Make housing affordable for nurses and junior doctors and the likes, and maybe we'd be able to keep our frontline staff. Secondly, doctors are human beings. They need downtime too. They may often be thought of as heroes, but they aren't superheroes. They are humans like the rest of us and need breaks to function better. If you are in an emergency department, you want to know that the doctors and nurses treating you are not exhausted and running on fumes. That is a recipe for disaster and unfair on both patient and staff. The training of new staff and the retention of our current doctors and nurses must be done as a matter of urgency. We need them, we need more of them, and we need them to view Ireland and our health service as a place where they are valued. Some of those billions need to be directed at this huge issue. Now, I don't know about you, but this whole situation makes me incredibly angry. Why the delay in preparing for something that the INMO have been warning about since July? Why do we have private hospitals and a two-tiered health system at all when we have the funding for a real, fair health service? Why are so many billions pumped into this failing, bloated behemoth known as the HSE? Because you see, this winter surge that Donnelly and others have been so quick to explain away as unprecedented due to the quote-unquote perfect storm of respiratory viruses is just the biggest, most inflamed symptom right now of our health service failures. Other symptoms include ridiculous waiting lists for public patients, a lack of urgent care clinics and injury clinics to bridge that gap between the binary GP or A&E choice, a lack of bed capacity, a severe staff shortage that's only getting worse, and lack of proper aftercare for discharged patients. Back before this new crisis kicked off, we had reports of 238 children waiting for scoliosis surgery, and a further 75 children with spina bifida waiting for surgery at the end of September 2022. That, in and of itself, is a detestable statistic for such a well-funded health service. Over 300 children living in constant pain and left waiting for surgery. Inexcusable. Go to minor injury clinics if you can, says Stephen Donnelly, in the full knowledge that there are 12 of them in 10 counties for the whole country. There needs to be far more investment in these sorts of clinics all over the country, with far better opening hours and with pop-up clinics for when demand exceeds capacity like we are seeing right now. Why do we not already have this bridge between GP care and A&E care, especially when GP appointments are so hard to come by? We have the funding. One of the best funded health services in the world. Inexcusable. Stephen Donnelly was full of ideas, full of vim and vigour when criticising Simon Harris's term as Minister for Health, and yet here we are. Make no mistake, the big ticket item right now, the overcrowding in our emergency departments, is not just confined to the winter months. As Minister Donnelly well knows, as he criticised Harris for the same winter emergencies lasting 10 months only a few short years ago. This same man has been Minister for Health for the past 2 years, and no changes, fundamental or otherwise, to how the HSE operates and where the vast funding goes. Inexcusable. As you can see, the problems with our health service are not born from a lack of funding. They are born from the inexcusable mismanagement of those funds. Government after government, minister after minister have failed to stop the rot. Did they even try? They might protest otherwise, but what we see tells a very different story. Our health service has been left by our government for civil servants to run. It has been left to become this bloated waste of funding that is so top-heavy with management that it is sure to topple one of these days. It's only a matter of time, and I wouldn't disagree if you said it's already happening. Until a government actually has the will to tackle the HSE, things are only going to get worse. Inexcusable. Instead of prioritising patient care, training and retaining of staff as a matter of urgency, and investing in better community-based care so that people don't feel forced to go to A&E for things that are just outside the remit or function of their GP, we have seen failure after failure, with wasteful spending of public funds compounding the ever-growing issues. Just this past week, we heard Leo Varadkar warn that the upcoming inquiry into the handling of COVID-19 should not be about pointing fingers. Barely a day later, we see an Irish Examiner piece highlighting the wasteful panic buying of ventilators through a company that up until that point had specialised in staging music festivals in Eastern Europe and the Middle East. Can we point fingers now? Just one example of waste in our health service. Inexcusable. We also heard Leo Varadkar say that he finds it impossible to explain why children have to wait so long to be assessed for special needs. This is a man who himself was Minister for Health and is now Taoiseach for the second time, and he can't understand why waiting lists are so long? Inexcusable. Now, I've only mentioned recent stories here today, but you can pick a year and find a scandal. Pick a year and find a winter trolley crisis. Pick a year and see ever-growing waiting lists. Year after year, it just gets worse and worse. Enough is enough. This is not simply unacceptable anymore. We all know that no heads will roll over this. We all know that Ireland doesn't do accountability. Sure, we might see the odd paper resignation, the odd apology, and we'll definitely hear that lessons will be learned, but no real accountability ever happens in this country. And worse still, the politicians with the power to change things will continue to pay lip service while conveniently ignoring that they could actually do something proactive for once and change things for the better. Leo Varadkar was quoted recently as saying that Ireland's two-tiered health service is not right or normal. Is he honestly for real? His party has been in power for the past 12 years. He is Taoiseach for the second time and was Minister for Health, and all that has been done over the past 12 years is cause the two tiers to have grown further apart. What more power could he possibly need to do something about it? Why has it taken him so long to realise that this needs to change? The cynic in me says this revelation is simply lip service to attempt to fool the electorate into thinking he cares. He doesn't. He's had 12 years and done nothing. He doesn't care. I guarantee you, if politicians were forced to use the public health service like the rest of us, instead of private services, things would change, and they'd change mighty quick. Inexcusable. We need to break free from this cycle. If the government won't do what is necessary for the public they are supposed to represent, then we must vote them out next chance we get. We must bring the accountability. We must support our nurses if the proposed industrial action is taken. Until then, we can only hope that the staff we entrust to care for our sick can do the best they can under dire circumstances, and hope that patients get the care and treatment they need. Stephen Donnelly can pretend that this year is different for whatever reason he likes, but we can all see the truth. And the truth is that each year it gets progressively worse, and not a single politician over the past 2 decades has done anything worthwhile to change course. Inexcusable. Thanks for joining me today as I merely scratched the surface of our failing health system. Please consider subscribing to the channel for more from me if you liked what you heard, and don't forget to hit that bell icon to be notified of new content. You can also follow me on Twitter for real-time reactions to the news of the day. And I want to say a big thank you to all my subscribers for all the support last year, hopefully onwards and upwards in 2023. No doubt with this government, there'll be a lot more to talk about. Until next time, slán go fóill.